If you're planning to spend time this summer in the great outdoors, you have to keep in mind tick season is here. It's arrived early in many parts of the country, and with ticks, we're also seeing tick-borne illnesses. Climate change, that is believed to be behind exploding populations of ticks, and federal data is showing a 1,000% increase in tick-borne illnesses over the past decade. This is a conversation we've had on a couple of occasions already with Dr. Isaac Bogoch, but it's certainly timely again. So he's back with us, our infectious diseases specialist from Toronto. Good morning and welcome back, Dr. Bogoch.
Great to see you, Heather.
You've been tweeting about this for weeks. I noticed May the 3rd, it's tick season. How's it looking so far? What's your sense of what kind of tick season we're in for?
I think we're going to see year after year after year. Unfortunately, we'll likely see more and more cases of Lyme, and not just Lyme, but other tick-transmitted illnesses. As we have, sadly, shorter and less cold winters in Canada, we're seeing ticks survive and thrive at more northern latitudes. They're spreading throughout the country. They have the capability to transmit Lyme and other infections. I think we have to obviously do a bit better to inform the general public that these infections are out there so that they know what to do if they have a tick and when to seek care. And also from a medical education standpoint, really working with primary health care and other healthcare providers to ensure that they're aware that there's Lyme and other tick-transmitted illnesses, and inform people how to diagnose it, how to prevent it, how to manage it, because we're sadly going to see a lot more of this in the years ahead.
Well, let's look at the number that we have from Ontario Public Health so far. 60 confirmed cases of Lyme disease in the province. This is just Ontario, of course, but it is just May the 28th. So 60, that seems high to me. Is that unusual?
Yeah, I think if we look at this time last year, it would have been about 40. And people say, well, it's a province of 15 million people. That's really not a lot of cases. We're underdiagnosing Lyme. There's a lot more cases out there than are being diagnosed. And this is really, unfortunately, a failure to consider the diagnosis among people in the general public who might not consider this, or among healthcare providers who might not consider it as a potential diagnosis. There's a lot of Lyme out there in Canada, and the official numbers are helpful, but we know that that's probably just the tip of the iceberg. We can do a better job in terms of surveillance and screening and testing patients, and of course linking people with care.
Okay, so let's get to the awareness part that you mentioned. I'm going to bring up some pictures, and you can jump in and bolster anything I'm going to share. This is the bug responsible. This is the tick. And Dr. Bogoch, this is the deer tick or the black-legged tick. That it has two names.
Yeah.
So this is
Absolutely,
it.
yeah.
Yes, and then this is
I was going to say it's also known as the Ixodes scapularis tick, if we really want to get technical. But yes, the black-legged tick, the deer tick, Ixodes scapularis. There it is in all its glory. It's disgusting. We hate it. It's terrible. I'm sure it has some ecological niche, but I don't really care about that because it's the bringer of pestilence and Lyme and other infections, and it certainly can make us miserable.
I'm just writing down Ixodes scapularis. I want to show the map, too, because getting back to what you mentioned, that the area where we're finding this kind of tick, it's really expanding. There's sort of it's a little bit busy, that map, but you see the areas all across Canada as it continues to move further and further north. So we want to avoid this. We want to avoid getting bitten. Just remind us of some quick prevention strategies, first of all, before we get to what happens if you are bitten. But to prevent this, what do you do to avoid contact with that whatever scapularis thing that we don't want to talk about?
Easy peasy. So, obviously the knee-jerk reaction is, okay, put on some longer pants and a long sleeve shirt when you're walking in tall grass or wooded areas. But of course, it's Canada in the summer. It's gorgeous. It's hot. Most people are going to be wearing shorts and a t-shirt and flip-flops. So that's not always practical. You can use insect repellent, which is very helpful, 30% DEET or 20% icardin. Those products are widely available in Canadian pharmacies. And the other key thing is tick check. So when you come in, hey, have a look at your body. These ticks can be really tiny. Have someone else look at the back of your legs or other parts of your body that you might not be able to see readily. And if you see a tick, remove it. It's not that hard to do, but that's the best way to prevent it. One other key point, though, in those maps are far from perfect. That's the best we've got for surveillance, but you certainly can see ticks, black-legged ticks outside of those areas. You certainly can get Lyme outside of those areas. And this is a dynamic map, not a static map. And those are just areas that are known to have Lyme, but there's areas outside that where people can certainly get this infection.
Remove them for yourself, also your children, also your pets, because that's, they're latching on there too. You mentioned removing. There is a proper way to remove them, isn't it? So let's talk about, if you do find a tick on your body, what do you do then?
So let's start with what we don't do. Don't burn them, don't smother them, don't use various products like petroleum jelly to, see if they'll wiggle their way out. You get a nice pair of tweezers, you go pinch as close to the skin as possible. You're trying not to crush it, you're trying not to twist it. It's just a firm pull outwards. And usually that's very successful. Sometimes a part of the tick, even after you removed it, you kind of smush it a little bit and some of the tick remains left inside. Use those tweezers to remove whatever they're often referred to as quote unquote mouth parts, but remove that part of the tick as well, and you should be just fine. Here's a key thing. We know there's a lot of Lyme, and we know that if a tick has been on for over a day, there's the possibility that those ticks can transmit Lyme. If it's a short period of time, it's likely not going to transmit Lyme. But if it's been on for, over 36 hours or so, that's when we know when these ticks are starting to get engorged that they can transmit Lyme. You can get Lyme prophylaxis, okay? So you can go to a healthcare provider, and in some places a pharmacy. You don't even need a healthcare provider in many provinces, including Ontario. And you can say, listen, I got bit by a tick. I removed the tick. It's been less than 72 hours since I've removed the tick. I'm curious about Lyme prophylaxis. You can talk with a healthcare provider, a pharmacist, and there's a medication readily available. It's an antibiotic known as doxycycline. Take this within 72 hours of that tick removal. It will significantly reduce the risk of developing Lyme if that tick had Lyme. Helpful, yes. Perfect, no. But it's just a great tool, and many provinces will even enable people to get that pill at pharmacies without a doctor's prescription, which just lowers barriers and access to care.